Thanks, Pat. I always enjoy hearing from you, and it's so good to see you and your pictures back there. I love it. So now we've got the gang from Eastern North Carolina on. Trillium folks will come on and talk about moving the navigation. I've personally appreciated working very closely with Cindy and Christy and Megan on this project, as well as Alyssa in different roles with the community care of Lower Cape Fear. So I'm excited to hear from them and their vision that they've had as an LME MCO and helping pushing this initiative forward, and looking forward to conversation in the small groups as well. So first, I think we start off with Christy Edwards, who is the Vice President of Clinical Operations, and then we'll have Cindy Ellers, the Executive Vice President, and then Megan Roberson, and then Alyssa. So let me pull up your presentation, and if you guys want to go ahead and just check your audio, be sure it works while I do that.
So this is Cindy. Can you hear me?
Yep, sounds great.
And this is Christy. Can you hear me?
Yep, good job, Christy.
All right, Megan, how about you? Hello, good afternoon. Can you hear me?
Yes. All right, Alyssa?
Great.
And hi, everybody, Alyssa Hansen.
Okay, good. All right, are we ready? I will do your fast forward your PowerPoint, so share my screen there for you guys. And we should just get going. Okay, take it away.
Thanks,
Christy,
Carrie.
Yep. Mm-hmm.
Yep, I'm here. Thank you so much. So we're excited to be here, especially hearing that there are lots of family members in the audience, to share with you an initiative that we've been working on for quite some time, but really working on steadily for over the past year in developing a Medicaid service definition for Family Navigator. And so you all already know this, or you probably wouldn't be at this conference, but what is a Family Navigator? A Family Navigator is someone who has lived experience with a person who experiences intellectual or developmental disability or traumatic brain injury, or the parent or primary caregiver of a person with intellectual or developmental disability or traumatic brain injury, who use their own experiences to help others navigate the ever-changing systems, including Trillium system and other systems throughout the state. The Family Navigator model was born out of the peer supports model that we use on the mental health and substance use side of services. That is a state plan service, and the really exciting news for us as it relates to Family Navigator today is that this has been approved as an in lieu of service under Medicaid, which means it's an entitlement for people who live in the Trillium catchment area. And it also means that this, because it's an approved definition, it could be adopted by other LME MCOs throughout the state if they so chose. Next slide, please, Carrie. So the core values of our Family Navigation program are promoting the philosophy of whole person, person-centered care. We want the Family Navigators to work with our partners to build trusting and collaborative relationships with our members, with Trillium as an entity, and with the network of not only providers, but the local community of resources that they're helping the people they're supporting to access. One of the important considerations is ethical and boundary issues. Family Navigators live and work in the community in the same community. And so making sure they're able to keep healthy boundaries with their own support group in the community where they live and might get support from other parents who are going through the same things that they're experiencing with their children. We obviously want to encourage people to access natural supports and resources that are available to them, not always to have a reliance on service systems, so they're empowered to be able to access those at their own convenience. And then also to make referrals to community and social supports and services. And then we also think it's really important, because you're navigating oftentimes medical systems, behavioral health and IDD systems, school systems, to take really, really good notes and keep records of the meetings that you've had, the contacts you've developed, and the resources that are out there. And so family navigators certainly work hard to help build those skills with the families that they're serving so that they can better navigate the system as they move forward. Next slide, please, Carrie. And so why did Trillium endeavor to build family navigation? Honestly, it's because of feedback from families like you who were saying it's a challenge to navigate this system. We need someone who has lived the experience that we've lived, who's walked in our shoes to help us to navigate the system and in the way that's going to make sure our loved one gets exactly what they need. And so our family navigators, through our partners, and Megan's going to tell you a little bit about our partners in just a moment, help everyday families navigate by leveraging their own personal experience in order to empower members to access the support and services that they need in our catchment area. And I'm trying to move through this relatively quickly, but the next slide, we're going to transition over to a video just to share with you some of the family members with whom we work and some who live throughout the state who either feel like they could have benefited for Family Navigator or who might have some interesting perspective as a family member.
It's working?
You got it.
All right.
Just might need to turn up the volume a little bit.
David, I'm not clear that sound is coming through.
And 2 weeks later, I was at a meeting and
Now it is.
we got a note to call home emergency, and she'd had her second seizure. And then from there, things just went haywire.
And growing up was tough. I was on medicine a lot. And it helped. But I'm feeling a lot better now. I have to control my seizures. They only happen at night. But growing up was really tough for me.
Sam is currently 32 years old, and he had a brain injury as a result of an accident in 2006. He was 19, and at that time, he was working, he was going to school, and had his future all planned. And he had the accident, and things changed immediately. It's always been a handful. He continues to be a handful even today. He's unable to move and unable to speak, but he makes his wishes known.
Christopher, at about 18 months old. And you know, you take your child to the doctor for whatever type of checkups, and you might begin to notice one thing or two things, but in a lot of ways I didn't really pay that much mind. Then his pediatrician, said, well, he should be speaking by now. At that age, 18 months old. So we give him a little more time. And as time went on, still no verbiage. So we go to the doctor over at East Carolina University. And they, after some testing, they said to me, Angela, we believe he has autism. I went outside from the doctor's office. I had to regroup and get myself together. And I go back in and I said, where did we go from here?
I think it sounds so cliche to say that I want them to be happy. I want them to be healthy. That's what you want. You know, I want Oliver to be able to find a place where everybody knows his name. Again, very cliche, but if you're a kid and nobody knows that you're there, I don't know what the point of that is. I'm sorry.
I worry about Dale and I as aging parents and the changes in the healthcare in North Carolina, and that he can continue his access to appropriate care, trying to put things in place so that when our children are caring for him when we're gone, that he can still live at home and have access to all the care that he requires.
Naturally, as a parent, you're going through a lot of emotions. You're wondering about, the onset of this. So imagine having a 3-year-old and 3 years behind, and for 3 years you're worried that if this is a genetic thing, it could happen to him. Thank God it never did, but it was tearing. So on one hand, you're trying to get your first child, get Mallory medical care, and at the second, you're sitting there waiting for the other shoe to drop, worried about your youngest child. So it's a very emotional time that nobody can understand. That really, if you haven't been there and put on those shoes, you don't really understand.
Everybody would run away if they could, but when your feet are nailed to the floor, you have to figure, well, we can make it through it. Just keep at it. And so far it's worked out. God has been with us each step of the way. And one thing, he won't give us more than we can handle.
When I first realized I had this ability to advocate, or this voice, it was honestly a subconscious thing at first. It was very instinctive because, I was a kid and I've had this disability my entire life. So, from an age before I even comprehended what advocating meant, I was like, well, this person needs to know that I need this thing, because if they don't know that I need this thing, then I'm not going to get it.
You're going to be their number one supporter. You're their number one caregiver. You're the person that knows them best. And sometimes you're going to be pushed to the limits, even with medical professionals, where you have to tell them what's potentially best for your child.
You always have to depend on others that are more experienced, trained, or educated in what you're not that familiar with. So it's always a balance.
The way I advocated for Cameron, who's 29, is totally different than the way I advocate for Oliver, who's 8. I mean, I really thought that when I started advocating for Cameron, I thought that the answer was to really be able to come in and have all the answers. And what I've learned now is I need partners. I need to come to the table with what I'd like to have happen for my kids, but I also need to be willing to listen to what whoever it is that we're trying to work with will be able to bring.
It can be a challenge because you're not always going to have everybody in your corner, and it's not always even a malicious thing.
And then you have the institutional issues. You have people on the other side, quote unquote, the other side, that would like to help, but their hands are tied. Sometimes the effort is to find a way that you can fit Sam's needs, a way we can fit Sam's needs into the circumstances and their programs that exist.
And it wasn't all malice, but there was just this idea that, no, that's not the way it works. Like, these people go over here, those people go over there. And so, advocating for integrated settings and the importance of normalizing that within the community is just beyond vital to anybody that is in sort of an unusual circumstance or anything. And that's the only way you'll ever see real change, is by just normalizing everything, including people in their community. And because once something is normal, then those attitude problems are going to exist more.
For Mallory, what my wife and I and our family have tried to do is, first of all, for the kinds of surgeries she's had, she has no left frontal lobe, and her corpus callosum, which is basically the superhighway that connects the left and right hemispheres of the brain, has been severed by 2/3. She has a job. She inspires people. They see her walking and talking and chewing bubble gum, and they realize that what a gift.
There have been times where I realized that there was so much more, I think, that we even were led to believe that they could do. That was kind of an amazing epiphany, but it didn't happen from one particular vet. It was kind of a gradual coming to that point with them.
Being there, standing up to it. If you feel like you got knocked down, stand up again. It's not over until you quit, and you can't quit without quitting, so don't quit. It sounds silly, but you just can't quit. Whatever happens, you can make it through somehow.
You try to leave that child with love. If they know and can feel what love and hope and encouragement is, what else can you give them? You give them everything that you possibly can, because sometimes you have one chance and you want to do it right.
Mallory, for all the medical challenges we've been through over the last 24 plus years and all the things that we've been through, we have found these silver linings, and her ability to motivate, to love, to inspire people because of their love.
Not that it's ever going to show them the way to get better than love.
We have created a new role for our coverage area. This role is called Family Navigator. The Family Navigator role is designed to assist people with intellectual or developmental disabilities or traumatic brain injury to navigate systems across their lifespan. Our goal is to have family navigators in each and every community.
That's a well done video and such beautiful families. Thank you for this. Okay.
Thank you, Carrie. And as you navigate back, I know that a couple of people asked if we could restart the video because there were some audio issues at the beginning. We will try to get that. Right now it's on a private server. We will try to get that in a public way so that it can be shared out with everyone. And at this time, I will turn it over to Megan Robertson, who is our director, or our IDD clinical director at Trillium.
Thanks, Christy. And I did see some of those questions in the Q&A, so I went ahead and included the link to that video in the Q&A. So as Christy mentioned, we'll try to get it out to everybody, but it's also there, assuming that everybody can see the Q&A that I responded to. So benefits of a family navigator. So I think from watching that video and knowing that a lot of people who have joined us today are family members, I think we can all identify the benefits of what a family navigator brings to the system, brings to our families, brings to our members. And some of the things that we have really honed in on as benefits for our members and families as we have worked to launch Family Navigator in our East area in Eastern North Carolina is that Family Navigators really help to fill a void in terms of having a trusted advisor who is credible. Obviously, we have lots of people who are working in the system and who also fulfill that role, but the role of a family navigator, or the role of a family navigator, I think that is beneficial to members is that they come from a place of experience. They come from having walked in the shoes that families have been in. They understand what it's like to be a person with an intellectual or developmental disability, or TDI, or have experience supporting a loved one through that. And so family navigators are credible. They have the ability to speak from experience in a way that other professionals may not be able to do. They also have the ability to provide just practical knowledge about how to navigate the system. when it comes to lived experience, a lot of our family members and members just have really practical knowledge about what to do. So, for example, in supporting members with Prader-Willi, family members have just found some really practical ways to help support members and families through that experience when it comes to food seeking or other dynamics that are related to Prader-Willi. And that's something that family navigators are able to provide immediately. In addition to obviously looking for resources in the system and providing those resources, they can just provide some really practical knowledge that helps intervene for members and families immediately. And with that, they're also resource experts. So having members and families that have navigated the system, they've experienced looking for resources to help address different needs. And so they really have become experts in terms of where are the resources to help support members in different communities. As I think we found in navigating the system as a LME NCO, and I'm sure as members and families can attest to, it's really about having that local knowledge and that expertise. And sometimes it's just about getting to that right person who has the right information to help and intervene. And oftentimes we find the best experts are our members and our families. They obviously can provide emotional support and hope. I think those two things are really correlated. So as you saw in the video from the experience that members and families had, that it's really, as a family navigator, they're able to really speak to what they've been through. And I think that they can provide some hope for families who are maybe at the beginning of their journey through learning about intellectual developmental disability, or TDI. So they can provide that hope for the future. I think as that one dad spoke to in the video, it's about being able to hope for the future and know now what he did not know back then was that his daughter would be able to have opportunities, to be able to walk and chew bubble gum, as he said. And our family navigators really can help provide that emotional support and provide hope to families about the future. And family navigators also work to help support the workforce and extend other professionals such as care coordinators now, as well as care managers in the future. Next slide, Karen. Thank you. So what has Trillium done to help support Family Navigator to grow in our area of Eastern North Carolina? We really have two pilots that we have been working on. The first one with Community Care of the Lower Cape Fear and Access East is something that later on in the presentation, Christy Edwards and Elisa Hansen will address. So for the purposes of this slide, I'm going to focus on the pilot that we started about a year ago. So about a year ago, in 1 month pre-COVID, we began our first cohort of family navigators and working with some pretty awesome provider agencies, the ARC, Autism Society of North Carolina, and Easter Seals UCP, who you will get to hear from a little bit later, so I won't completely steal their thunder, but did want to just kind of point out some of the efforts we've made. In that first pilot that we had with those three agencies, we trained a cohort of family navigators over the course of 2 days on some aspects that we felt were pretty important to be able to support family navigators, and in addition to supporting our members and families. So we started with a pilot with those three providers where we really reached out to our communities to identify what are the needs of members and families. As we were developing Family Navigator, we really wanted to have a focused effort on supporting our members and families, and that began with identifying what the needs are. How can we best support our members and families through this endeavor? And that was our first phase, which we have now moved into our second phase, where we are really working to, now that we've identified needs for our members and families, helping to support family navigators to address those needs and intervene. Next slide. So what are the functions that our family navigators are performing for our members and families today? I think 3 core functions that I'd like to highlight include advocacy. And advocacy is on a spectrum. It begins, well, obviously, with the family navigators helping to support and provide advocacy to members and families. And that's obviously through a number of different means, but really focuses on role modeling how to do that and helping to build those skills for members and families so that they just don't get support at the time that they need it, maybe at an IEP meeting, but they can get that, they can develop that skill long-term to help support themselves. Outreach and information. So obviously education is huge for family navigators, helping to support families that are just beginning their journey or right in the midst of their journey. So being able to provide them information about different funding sources, relevant services and resources, helping to advocate them about different things like the grievance and appeals processes for different agencies and entities. And then lastly, I think one of the main components that a family navigator helps to fulfill for members and families is building those connections. We know that connections, be it natural supports in the community, are absolutely crucial for our members and families. And so we really focused on helping our family navigators to learn about developing community connections and natural supports. So developing those natural supports that they might have existing, but just haven't completely fleshed out into a natural support. So helping them to develop those relationships further, but also develop community connections that will help to maintain and sustain them moving forward. Next slide. So what conditions does a family navigator target? So I think the conditions that are really important for a family navigator to acknowledge when working with families, and I know our family navigators work really hard to honor each of these, really starts with respect. All of our members and families are unique and different, and they bring unique aspects to the table that really will influence the care and support that they need to receive. So that's really about honoring the diversity of our members and families, their cultural traditions, and really helping to make sure that that is at the forefront of the care that they receive. Partnership, obviously working with families as a partner, understanding that because of the unique aspects that they bring to the table, the strengths that they have, that those are really going to drive the decisions for members and families. And so working to partner to understand what those unique dynamics are and helping to present options that really work for families and help give them the tools that they need to make informed decisions. Obviously, when we're doing all of this, it has to be, the information sharing has to be open, objective, and unbiased. Presenting all options to members and families, giving them the choice and allowing them to make a choice that makes the most sense for them. And then obviously negotiation. So working with outside entities and agencies really requires a finesse from family navigators to help find the middle ground that maybe works best for that member and family. Next slide. I believe at this point, I'll turn it back on over to Christy.
Thanks, Megan. So how did one become a family navigator when we first started this? We worked with our partners at Autism Society, Easter Seals, and the ARC of North Carolina to have an opportunity for a learning cohort. People applied with sponsorship or employment opportunities through one of those 3 agencies to participate in a face-to-face learning cohort. And what we saw through that, and what we wish we were able to have on an ongoing basis, is that those family navigators are still in contact with each other. They really developed a partnership, and you're going to hear from them later today, so I'm not going to go too much further into that. But so it all started with a training curriculum through Trillium. However, at this point, each of these 3 provider agencies have their own approved training curriculum for family navigator that they're able to provide as they onboard new staff. Next slide, please. So the criteria to be a family navigator, obviously, we've talked about this quite a bit, but it's a person who has personal experience either themselves or through providing care to a loved one who experiences intellectual or developmental disability or traumatic brain injury. Because again, there are some things that were important for us in terms of getting this approved for a Medicaid service definition. You would have to have a high school diploma or a GED, and you would have to complete the approved training curriculum for that. And then the services that you deliver would be based upon the training that you receive and the unique qualifications that a family navigator has through their own experience. Next slide, please. And so this is just a little bit of an overview of the training cohort. So everyone who came into the learning cohort was really committed and did some homework in between sessions. And so this is just to give you a little bit of an idea of some of the topics in training. And then I wasn't able to participate in the first day, but the second day I got to participate, and it was just so much fun to spend time with these family navigators, again, who you're going to meet in a few minutes, but to do role plays and develop scripts in order to make sure that we were rolling this out in a standardized way, but also in a person-centered way to meet the needs of the people who they would be providing outreach. And so this is just a sample of what the training curriculum looked like. Next slide, please, Carrie. And just to also share with you all that Trillium does offer training on demand. We have a learning campus called My Learning Campus, where you can, as a community member, go in, develop your own login and access trainings, where our providers who are hiring family navigators can direct their staff to take some on-demand trainings. And of course, our staff also use that to get training and stay up to date on new services like Family Navigator into our service system. And so you can go ahead to the next slide, and I'm going to turn it back over to Megan, who's going to wrap up our formal presentation before Cindy shares some thoughts and Elisa shares some thoughts about the pilot.
All right, thank you, Kristen. So what are the outcomes so far since implementation? As I mentioned before, we had started a pilot with the Autism Society Easter Seals in the ARC. So we have finished our first phase, which was really data surveillance and making sure that we had gathered some information so that as we implemented Family Navigator, we really had a focused approach to what our members needed. So as we move into the second phase, we're really looking to address the needs that were first identified during the surveillance phase. So our outcomes are, as they're currently in the midst of addressing those needs, and our data is being collected. But what we have seen thus far from our initial data surveillance, as well as some initial data that we're getting out of our system, is really promising, and we're really excited to be able to share all of that information as we conclude our pilot in the future. But initially, what we have really done is take the surveillance data, which really revolves around identifying needs such as referrals, whether or not members or families needed support to be linked with behavioral health services, identifying if there were any physical health care needs needing to be linked with services. Also working with families to see if they needed support in the school system. We understand that IEPs and 504 plans and all of the rules and regulations associated with that are really complicated. Reaching out and asking members and their families if they needed assistance to manage their health and learning how to manage their health. So for members who maybe have a diagnosis of diabetes in addition to intellectual and developmental disabilities or TBI, did they need support to learn how to better manage their diabetes? We also surveyed our members and families to see if they need help with just basic needs. And that really boils down to unmet health-related resource needs, or also known as social determinants of health. We also understand that navigating benefits such as Medicaid and Social Security can be very difficult, so we ask some questions about that. Making sure that members and families had meaningful day activities was also important, as well as supporting members through life transitions. We understand that's very complicated as you move from one system to the next. So those are all the areas that our family navigators are really targeting today, in addition to any other needs that members and families identify. So as they're working to address those needs, the things that we are really finding is that they are able to help support members and families to be linked with basic medical services, such as annual physicals and dental exams. Some basic primary care needs are being able to be addressed. That's obviously between physical health as well as behavioral health. We're also seeing an increased access to services. And that's really important to us because we do understand that being able to intervene and provide the preventative care for members such as dental care and primary care is really important to member outcomes in the long term. And so there's also meaningful engagement. If you'll pop back to that last slide for me, Carrie. Or there you go. Also, there's meaningful engagement in those services. So if a member identifies that they need help to be linked with a behavioral health service, our family navigators are able to connect that member immediately with our behavioral health call center and be linked with services right then and there. And not only just the referral piece, but because the family navigators are involved with our members, not only initially, but also ongoing, they're able to follow up just to make sure that the member or family was linked with a needed service. And that really helps to maintain some continuity between addressing a need or identifying a need, linking a member or referring a member for a service, and then actually making sure that they get linked with the service. And all of those things, being linked with physical health care, behavioral health care, meeting basic needs, making sure that our members have benefits that they need, navigating the school system, all of those things are really important for a number of reasons. But specifically, a few examples where we see the benefits is being able to avoid those higher levels of care. So when you think about being able to provide a behavioral health service, something just as simple as respite now can make the difference for a family or a member long-term in terms of having to go to the hospital because of maybe a behavioral health episode and the family not having a break at all or any support through that situation. Obviously, it helps to reduce the use of crisis services as well as any out-of-home placement or treatment services are avoided. Next slide, Kim. So what else is important about Family Navigator to kind of pinpoint? We've obviously gone through what the benefits are, what are some of the outcomes that we're seeing and expect to see long term. I think one thing that is really important is we're about to, most people on this call have probably heard about Medicaid transformation. It feels like it's been the buzzword for a couple of years now, but it's happening come July. Our standard plans will be launching, and next July 2022 tailored plans will launch. And so as we look to this really complex change in our system for Medicaid, we see even more the need to help support members and families navigate an ever-changing system. And it's also important that family navigators, I mentioned this earlier, but they can really act as extenders of the care management workforce, helping to provide a focused intervention for members and families. And when you look at it from a system standpoint or from managing care, being able to intervene now with the support of family navigators, to the example that I just provided, being able to provide a behavioral health service proactively or preventatively helps to avoid those higher levels of care and cost for the system, which makes it manageable for the system and helps us to be able to expand out services and better manage those funds. And obviously, as I mentioned, it helps to prevent those higher levels of care that we want to try and avoid at all costs for our members and families, including institutional levels of care, crisis services, and visits to the emergency room, or potentially even inpatient visits. So intervening now and being proactive is something that we feel is very important, and that Family Navigator has a very defined role in helping to support our members and families through their journey. So that concludes our formal presentation. So I will turn it over to Cindy and Elisa to talk about our pilot with Community Care of the Lower Cape Fear and Access East.
Yep. So I'll just jump in here. This is Cindy Ellers, Executive Vice President here at Trillium. And I just want to say that it has been such a privilege to have the ability to influence this. For those of you who don't know me, I am also a parent of children with developmental disabilities. And so I live the system from the inside out and the outside in. And that is a really unique perspective to have in the role as a decision maker at Trillium. It has certainly helped us to be able to bring Family Navigator to our communities. Really excited about you being able to hear from Holly and Kim later this week, who are two of the folks that went through our Family Navigator, and even more honored to be able to have them in these roles, as well as all of the other Family Navigators who are working with our partner agencies. I just can't say enough about the collaboration between all of the different partners in terms of agencies that we're working with, as well as the individual Family Navigators. It's been quite inspiring. And just a couple of things that I would add. You know, we had to start somewhere, but the sky is really the limit with what Family Navigators can do. And when Elisa starts talking in just a few minutes, you're going to hear about a totally different perspective, more integrated care as it relates to Family Navigator in a medical practice role. I know that happens some other places in the state too, and that's real exciting to see taking hold all over the place right now. We know when we talk to groups, we've talked to lots of different groups about this throughout the state, and we know that there's a real need for this in early intervention as children are identified early, who may need testing, whose families may be facing a diagnosis for the first time. That this is something they really need as a support to help them benefit from other folks' experience and learn how to navigate all the systems that are ahead of them across the lifespan of their child. We also know and have no doubt that as we begin to work in the tailored plan and start to talk to individuals who live in community ICF or state-operated ICF facilities or institutions in the state of North Carolina, that Family Navigators will be critical in the role of helping people move back into the community and have their best life reintegrated from those settings, in hopefully in some cases into their own homes even. And so we hope to see Family Navigator expand over time, but what we're here to talk about today is just where we're starting, not where we're finishing. And so that's just real important to realize. The sky is really the limit of the places that we can go with Family Navigators to really move the system forward in a totally different and dynamic way as we approach Medicaid transformation. And moreover, if more LME-MCOs would adopt this service definition for Medicaid and help move it forward. And so I just wanted to say those two things. Couple of things before I hand it to you, Lisa. Our Learning Campus is available for members as well. I know Christy talked about it from the training of providers and training of our own staff, but it is also available to members and families. And anyone can create a login to our Learning Campus. So if you're in the audience today and you're interested, you can go to the Trillium website and log in. You can download any of the information there. It's all available for the taking and learning. And certainly, as our family navigators talk to families, there are some families that can, find a checklist for an IEP and take it and run with it and go handle their IEP meeting with just a little bit of information in a really self-directed way. And other family members need somebody to go with them to the meeting. And family navigators can do that at whatever level is needed by the person. So we're not prescribing that at Trillium. We're not saying you can only go with them one time, go with them 20 times. What we're really after is making sure the person's needs are met, they're met well, and that this experience is leveraged in a way that makes a difference in the person's life. So just important to know that Learning Campus is available. It's available to you out there in the audience. Also, just to give a shout out to Matt, who I think is here today, who helped us with our video, and a shout out to Latoya, who's with the Division of Mental Health EDSAS, who I saw is also in the audience, who participated in our first learning cohort around family navigator and the development of this definition. So it was really great to have her support as a leader, thought leader in the Division of Mental Health. So I just want to give a shout out to those two because I saw they're in the audience. Anyway, I'm more than happy to answer any questions as Elisa goes through her presentation. And I just want to say before I hand it off, last thing is we hope you'll use our video. We hope you'll take our materials. We would love to see everybody steal this and make it real throughout the whole state of North Carolina, make it better than Trillium started with it. And with that, it's all yours, Elisa.
Thank you, Cindy. I want to thank Trillium first for this partnership. Our medical providers are really excited about it, bringing this in the medical community. But first, I want to start with a little bit of history from the perspective of Community Care of the Lower Cape Fear as a care management agency with a network of medical providers. The framework for how we approach this pilot with Trillium first came from a pediatrician in our network, Dr. Tribier with Med North, which is an FQHC in our network. She came to us and did her practicum. She was working on a master's in public health and she wanted to do her practicum here. And her and I were talking about what her project could be. And at the time I was participating in a work group led by Karen Lukin on promoting the IDD medical health home concept. And so I started talking with Dr. Tribier about this and it really intrigued her. And then we started thinking, well, what if you were to use your own practice as a way to put this into motion and make it real? And so we both agreed that this could be a really good public health initiative for her practicum because of the significant changes coming with Medicaid managed care and how service delivery is going to happen under the tailored plan. This could be a real good project for her to just kind of set the groundwork for whole person care with the IDD population. And she herself, being a pediatrician, knows how the importance of whole person care with this population. So she did that as a practicum, and it was a really interesting project for all of us. And then Trillium came to us and proposed this idea of taking this into medical practices. And we quickly said yes, because we felt like we could take the lessons we learned from her practicum and the foundation, the beginning of a foundation concept, and and take that into other medical practices. And so that's what we have done. And so we started here in 2021, and we have 2 pediatric practices here in New Hanover County, and we are embedding a care coordinator and a family navigator into those practices. And without getting into too much details on how you make the sausage, the three overarching goals that we have in this project: number one is to engage a higher number of patient and families in linking them with available services and supports, and really meeting them early in the life of their child so that they can see a vision of what's all available and all the supports that'll be available at different ages and stages. Assessing them for what needs they are going to have at their current time, and linking them with the supports that they need. And number two is demonstrate the impactfulness of having a family navigator in your life. And this is early on, but we've already have these experiences, met parents that Ashley is our family navigator, and we are already feeling that impact in their life, but we want to demonstrate that by tracking outcomes and such. And number three, enhance whole person care by developing practice-wide standards of work. So helping medical practices really prepare for whole person care, not just for the tailored plan, but in terms of just this is best practice, and helping them go way beyond that medical focus and learn that there's so much more to good care in relation to have meaningful life activities and having those kinds of supports available, and helping patients link with them. So having the standard of work in a practice where you can everyone knows the way to work with those patients and families, and that is a standard for everybody. And then we also are going to help practices create practice branded resource folders that they can hand over to families that will give them the information they need at the time they need it. And then number three is to develop two-way communication referral pathways. So, these are often patients who need some specialists and some other types of providers in their life, right? So how do we keep all those providers communicating and understanding who's doing what? And that doesn't happen organically, unfortunately. And that's what we've learned in care management on the medical side, is that we have to sometimes be the hub of that wheel in order for everyone to know what's happening with that patient. And so we're creating those pathways for that, those practices, those providers. We're tracking what's this like for providers, what they know on the front end and what they're gonna know on the back end. We're tracking satisfaction from the parent and from the patient's perspective. So we're excited about it. You are looking at a flyer that the practice is using to give out to patients so that we can educate them on this is now right here at the practice, that you can go and talk to these folks and have access to their supports. So we have, our care coordinator, we have our family navigator, and then Richard is our clinical supervisor. And we would be happy to entertain any questions you might have about it.
Thank you, Alyssa. And
you're welcome.
Thank you, Megan and Cindy and everybody. And Christy, I'm just quick looking at the Q&A because I know that we are running a little over, but that's okay. There's so many things. So yes, I mean, there's a lot of live answering questions in the chat, and lots of different projects. Yes, Tamara, and different things. So yeah, I think probably if you guys want to just send any other Q&As up, we'll certainly take a peek at those, and we can either answer, live in the chat, or we can talk through. We do want to allow you guys to have the participants to have 5 minutes to just take a break, get up, get a glass of water, and then come back to hear from the actual family navigators themselves that are part of this project, and that's the next session. So let me peek one more time just to be sure. And I think I know almost all of you on here, so hey everyone. This has been a good presentation. Okay, let's just take a break then and come back at 3:03. How about that? And we'll hear from, we'll kick it over to Lisa Petit from the ARC to lead us into our next session.
Thank you very much, presenters, and we'll definitely follow up with you in terms of staying in touch with the work that you're doing and how we move this forward.
Thank you, Karen, and everyone for including us today.